everyone. Welcome to the Kidney Cancer Association's first annual Patient Symposium. My name is Courtney Feierach. I am the Senior Director of Programs and Partnerships. Sorry, just having some technical challenges, of course. Senior Director of Programs and Partnerships with the KCA. Also, my colleague Rosemary Chestak will be joining us this afternoon. She's the KCA's patient liaison, and she's going to be helping moderate and answer questions as well. On behalf of the Kidney Cancer Association, we thank you for joining us today. We sincerely hope that you find this program to be helpful for you no matter where you are in your kidney cancer journey. 2020 is a really special year for the KCA. It is our 30th anniversary. So be sure to check out the Kidney Cancer Association's website, which is just kidneycancer.org. You can find a lot of information there on how to help celebrate the 30th anniversary, as well as some of our different patient education and support materials like our Just Diagnosed Toolkit and the Patient Navigator program, where you can talk to Rosemary and she can help find different resources that you need. You can also share your story or find out ways to get involved. All that information is at kidneycancer.org. So as we go through the presentations today, there is an ask a question box kind of to your bottom left-hand screen where you can type in questions, and we'll be monitoring that so we can make sure that we can get your questions answered. During the scheduled break times today, be sure to visit the exhibit hall. There you can access that directly through this session that you're in now. There's a place where you can just click through to the exhibit hall. The KCA booth has tons of great resources and direct links to a lot of the patient education resources and ways to share your story. Sign up for our Unstoppable Together newsletter. So be sure to check all that out and make sure to click on some of our sponsor booths as well. Speaking of our sponsors, we'd love to thank all of them today. Exelixis, BMS, Bristol Myers Squibb, Eisai, Pfizer Oncology, and Novartis. Thank you for your support in making this happen for us. So without further ado, I would like to welcome the moderator of the Survivorship panel. Laura Wood is the Renal Cancer Center Research Coordinator at the Solid Tumor Oncology Program at Cleveland Clinic. And she's also the co-chair of the KCA's Clinical Advisory Board. But most of all, Laura is extremely passionate about improving the lives of people living with kidney cancer. So Laura, I will pass it over to you. Take it away.
Wonderful. Thank you so very much, Courtney. And thanks to everybody, especially thank you to our panel participants, because without you, we wouldn't have the opportunity to share firsthand what it's like living with kidney cancer and managing things on a day-to-day basis. So I'd like to go ahead and jump in and have each of our panelists introduce themselves. And then we've got some questions we've got planned and would like to very much have participants add their questions that we can then incorporate it into the panel discussion today. So Brian, I would like to start with you and let you introduce yourself, followed by Kathy.
Hi, I'm Brian Moran, and I am 51 years old. I live in Wilmington, Delaware. I was diagnosed with stage 4 renal cell carcinoma about 1.5 years ago. Diagnosis, probably like a lot of people, wasn't expected. You know, fluke sports accident and found some things, and just kind of been working through it ever since. So hopefully some information we can get today will be helpful with everybody.
All right, so I don't know if the web support group can show us a quick picture of Brian, because Salima, we love you, but you definitely are not Brian. But we've got Salima showing, and Brian was trying to get introduced. So why don't we do this? There we go. Now we know who Brian is. Thank you very much. Yeah, ongoing tech difficulties. So this is Brian. Thank you so much. Now, can we switch to Kathy?
Okay, so I'm only on via audio today because of technical difficulties on my end, I believe. but I can give a brief intro of myself. Just like Brian, I'm a native Delawarean who live in Wilmington, Delaware, with Brian and our two golden retrievers, Mavericks and Daisy. I work in the financial services industry. I've been in that industry for about 30 years. But outside of the office, I'm an avid runner. I've completed over 100 marathons in all 50 states and DC, as well as the 7 continents. I love to travel, and through travel, I get to learn about different cultures. I also like to volunteer in my free time, whether it's with the local hospital or with the Pause for People, which is a therapy group for dogs. And then finally, spending time with family and friends. So again, like Brian, I hope the information we can provide is helpful to the participants.
Wonderful. Thanks, Kathy. Michelle.
Good morning. I wanted to just introduce myself. My name is Michelle Piccolo. About a year ago, a little over a year ago, I was diagnosed with stage 3, grade 4 bilateral kidney cancer. I had some blood in my urine and went and started getting tested and found out pretty quickly that I had a tumor in both of my kidneys. My right kidney was totally removed with a radical nephrectomy, open nephrectomy. And then about 6 weeks later, I had a partial nephrectomy done on my left kidney. Because of a family history of cancer and kidney cancer, I've also undergone genetic testing, which I tested positive for the BAP1 gene. Since then, about 6 of my other family members, so 7 of us total, have now tested positive for that genetic, the BAP1 gene mutation. So that's been a big part, the research part of it all. I've changed to a hospital that does more research than my initial surgery was done at. I had them done at 2 different hospitals. So we're just looking to further, people's knowledge and information on having genetic testing done. This is my 2nd cancer. At 21, I was diagnosed with melanoma. And so then at 45 was when I was diagnosed with my kidney cancer. So we're just trying to spread the word, about things like that.
Wonderful. Thank you so very much. Salima, would you like to introduce yourself?
Absolutely. First off, thanks for having me and happy anniversary, KCA. I'm a stage 3 kidney cancer survivor. I was diagnosed over 2.5 years ago. I'm currently in remission. I've been in remission since my nephrectomy. And I'm just very thankful and happy to be here and hope I can provide some insight. I myself as well underwent genetic testing. There was no genetic component in my involvement in getting kidney cancer. It was found incidentally. And I'm very thankful to be here. So thank you for having me.
Wonderful. John, come and join us.
Hello, everyone. John Farrell. I was originally diagnosed in 2010 with stage 3 renal cell kidney cancer. And I was essentially cancer-free for 7 years, and it metastasized to my lungs and my pancreas in 2017. So I entered a clinical trial. I did that for a couple of years, was in remission, and was in remission for about a year. And then a couple spots popped up earlier this year, and did another trial treatment, of which some of it was FDA approved, and wiped that out as well. So I'm currently in remission. I guess stage 4 survivor as well as some of the other folks here. So happy to be here. Thanks for having me.
Wonderful. Thanks, everyone, for joining us then. So let's start off the conversation regarding initial diagnosis. So, Brian, you were in a unique situation, but not all that unique, because the decisions about surgery versus no surgery has really transitioned over the last 6+ years. So what was it like for you being told that a nephrectomy was not a recommendation?
Well, actually, it was very unnerving at first. Actually, because actually, you have a lot of questions. You're scared, just like everyone is when we first find this out. And so you want it out, right? That's everybody's response, just get this out of me. And when they said no surgery, I was kind of confused. And even my a very close friend of mine who is a renal specialist here locally, I've known since high school, he even was surprised when I told him that they're not recommending surgery. And so the reasoning being, because it was stage 4 and it had progressed through many places in my spine, in my hip, in my ribs, they were just like, for us to go in and do surgery would be disruptive to the treatment that we want to do. One, it's going to delay it, and then it's also because they want to put me on immunotherapy. Instead of my immune system fighting the cancer, it's going to try to heal from the surgery. So they said, we don't, that's not kind of the top tier for stage 4 anymore. That's not the top tier of our care anymore. So I went and got a second opinion at UPenn. That's one of the advantages of where I live. There's several NCI centers within a half-hour drive of me, actually, because Philadelphia is right up the road. So I kind of had my choice, and I went to Penn, and they basically said, your doctor is 100% correct. This is the care. This is exactly what we would do. We would not do surgery on you. And again, they re-explained why, and that kind of put me at ease. And I said, okay, if that's the state-of-the-art care that we're going with, then we'll go with it. And it's turned out very well since then. But that first time of the doctor my oncologist talking me through it, it was very kind of unsettling. But again, I got a second opinion. I looked into my current oncologist here locally, rave reviews from people about him and his care and the organization that he's with. And so I felt somewhat confident going into immunotherapy versus and radiation therapy versus surgery.
Wonderful. Thank you. Michelle, you alluded earlier with the introduction. Okay, hang on. We're getting reverb. Okay, Michelle, you had alluded to in your introduction that you had been diagnosed with tumors in both kidneys.
Yes.
What was your reaction with that as far as how to manage it and how to adapt to it?
I initially went to the urologist who did my first surgery, and he was very, very adamant on concentrating on one thing at a time. His first plan of action was to deal with the right kidney. At the time, I was asking questions about the left kidney, and he said, we'll get to that next. The immediate thing we need to take care of is the right kidney. So it was kind of like a one step at a time approach. We went in and he took the entire right kidney. It had gone into the vena cava. There was, lots of involvement there, which, explains the stage 3 diagnosis. So we went in, got all of that scheduled, came back for follow-up. And at that point, I was saying, what about my left kidney? What about my left kidney? And his approach was for me to see a more specialized doctor at that point at Tulane Hospital in New Orleans. And so we went there, and of course, the next step is we need to do that side. So, and the biggest part of that is we were trying to save as much kidney as we could. And so, luckily, because of the placement of that tumor, we were able to save almost 90% of my left kidney, which was really exciting to me. We were hoping initially even for 75%, but we were able to save 90, and that's been amazing for me. Like, as far as my kidney function is still, I say great. I guess I'm just excited for what I have. But so it was really just a one step at a time approach. He was really good about pacing me and saying, let's not worry about that left yet. Let's take care of the right, and we'll do one step at a time. And so my surgeries were about 6 weeks apart. So I had really just healed from the right when we went in and took care of that left.
Yeah, so that was an extended period of surgical healing then for you as well.
Correct.
Thank you.
Yes.
Yeah, thank you. Salima, when you were first diagnosed And everyone's journey is different. What was the biggest challenge for you with your initial diagnosis?
It was shocking. I was healthy. I was just living life like everyone else. And I think it was trying to get my hands on information, you know, having no cancer in my family, having no experience with cancer. Initially, it was the just immediate shock and having to get information, where to go, what type of doctor, what was I dealing with. That was the first parts of contending with that. Once I got my grip on that, made doctor's appointments, figured out what we needed to do, figured out if we needed to get a nephrectomy, I was able to absorb the information that I was given, and I will move forward from there. That was the initial stage for me that was the most difficult.
And at that point, did you get involved in the Kidney Cancer Association, or was it later that you became involved or learned about them?
I learned about them right away, actually. They were one of my initial sources for trusted and true information regarding kidney cancer. So I looked to them for information at the beginning. And after treatment and after surgery and healing, I wanted to get involved. And that's when I contacted them to share my story.
Wonderful. Thank you. And I think that's a huge thing that helps other patients who are experiencing the exact same feelings that you did with your initial diagnosis, is knowing that somebody else has been in the same situation and learning from that.
You do feel alone, and know that you're not. There's many of us out there, and you're not alone.
Thank you. So, Michelle, talk about the discussion with treatment decision-making. You had no evidence of disease after your surgery, and you had discussion with your oncologist about adjuvant treatment, or what could you do with treatment to minimize your risk of it coming back. Do you want to share with that, Michelle?
Sure. I met with my oncologist and we looked at different treatment options. He presented to me the facts about, he gave me a patient handout. He also gave me the research, which showed that the therapy that we would choose to use, that was an option that would help for me, would only delay the reoccurrence of my cancer. There was nothing showing that it would prevent me from having a reoccurrence of the cancer, and that I would still, it would just delay it for about 2 years is what we were shown. Because of that, I met with my family. We've discussed options. We've discussed side effects that we saw in the research. And at this time, we've decided not to pursue that. I'm not saying that that's something that we would never do. At this point in my journey, that's what I feel, we all feel is best for me. But it was really great to have the doctor that was so supportive, that gave me not just the patient information, but the research. And sometimes you look at this research and it's so far-fetched, and it's facts and figures, and it's words you may not come across in your everyday language, but he was really good about explaining that. And just, you know, any question I have, always to me, ask questions, because they know. And I mean, doctors see patients every day and they don't know what we don't know. And so for us to arm ourselves with knowledge and to know what it is and to weigh the pros and the cons is a big part of what made the decision that we made for me.
Great. And Michelle, I'm going to stay with you for a moment, but I'm going to switch gears because we got an excellent question from one of the participants. If you could explain the BAP1 gene and the conversation you had about genetic testing.
Yes. So a big part of why my doctors recommended genetic testing is because I was 44 at the time. This was my second cancer already. My grandfather, we lost to renal cell cancer. And that's been about 20 years probably. So we knew there was a family history. My mom's a breast cancer survivor. I have other family members that we've lost to cancer. And so there were so many questions about why someone who was young has had a second recurrence of cancer and things like that. So it was super easy test. It was just a saliva test. You collected the saliva in a little container. I actually did mine at the doctor's office. It's mailed in. A few weeks later, I got my results, which mine tested positive. So the immediate thing that we did was we tested my parents and my 2 daughters and my 2 siblings. My mother came back BAP1 positive, so that's probably where I got it from. Both of my children luckily tested negative, and amazingly, both of my siblings tested negative. Many of my mother's siblings, my mom's one of 7, many of them have tested positive for the BAP1 gene. And one of them has also, since that time, discovered that she had melanoma also. The BAP1 gene, I'm not a geneticist. I've met with a geneticist, and so I know information from them. But it also leads to most common cancers are kidney cancer, melanoma, ocular melanoma, and mesothelioma. So the big part of our screenings for that is for us to know to screen for those types of things. Yearly, I'm getting eye exams now where they take pictures of the backside of my eye to look for freckles and moles. We do tests to look at the lining of my lungs. We just do screenings. And so the biggest part is like family members is they suggested, since I was almost 45 at the time, so they suggest for now my family members who have tested positive to begin their screenings 10 years prior to when I was diagnosed. So, and my grandfather was in his 50s when he was, late 50s when he was diagnosed, and I was in my 40s when I was diagnosed. So now the biggest advantage to knowing the BAP1 results is that, you know, my cousins who are testing positive and other family members who are younger than me can start their screenings now and hopefully catch it. If they start to develop something, hopefully we can catch that at stage 1 instead of being a stage 3, grade 4, where they had to lose, you know, 1 plus another piece of a kidney, you know, so it's more for us helpful to be proactive about it.
No, that's very helpful. Thank you. Another question. Go ahead, Michelle.
Oh, I was going to say, I know that there are other genes that also, you know, give you a higher predisposition. It's not only BAP1, because like when I've talked to people and we're talking about things, they test positive for other genes that, you know, lead more to a kidney cancer. So the screening that I had done, it tested for lots and lots of different things. So it could tell you, you know, it might not just be BAP1, it could be other genes that have mutated that, you know.
No, that's helpful. And that's a discussion that's important for individuals to have with their physician is genetic testing appropriate? Thank you. Correct. So we've got another question for the audience. And actually, I'd like to direct this one first to John. This is in regards to the biopsy. So you had your original surgery, were free of disease for a while, and then developed a recurrence. Did you have a biopsy of the second tumor that came back?
Yes, I did. And just to, you know, I didn't have a biopsy on my first tumor. It was just the way it looked presented itself on CT scans. They had a pretty good idea what it was. So when it did return 7 years later, I had multiple nodules in my lungs, and that's what we first started watching. We initially did a biopsy on one of the lesions in the lungs. That biopsy actually came back negative. And we kind of went back under observation. I was going back every couple months, and they were slow growing. Then the lesion on my pancreas popped up, and that one started growing fairly rapidly, and that got up to almost 3 centimeters. We did a biopsy on that one, and that one was confirmed as clear cell renal cell carcinoma, so it was a metastasis of my original tumor. And the lung nodules never presented themselves as clear cell RCC, but they're presumptive as being positive because when I started my clinical trial and started treatment, all of the lesions that presented themselves on the CT scans were responding to the treatment, and ultimately all disappeared after the trial. So yes, the biopsy did confirm it initially.
Okay, thank you. Brian, let me pose that same question to you in regards to your initial diagnosis and biopsy, and then also transition a little bit to talking about support and caregiver support and working with that.
Right. So my initial diagnosis came after I had injured my back exercising, and that was in September of 2018. And after going through several months of chiropractic care around those, I was sent to an orthopedic doctor, and through the MRIs and all through the orthopedic doctors, how we discovered the cancer. So then I had to go through the various, because of course I'm there for orthopedic, a hip injury maybe. It was kind of shocking, to find out you might have cancer. They did do a biopsy to confirm everything they had seen on the CT scans and the MRIs, that it was, stage 3, renal cell carcinoma. So again, that was a shock. My orthopedic doctor is the one who's actually guiding me through the initial diagnosis because my family doctor had just retired and I hadn't found a new one yet. So he was even acting as my family doctor. So it was definitely shocking. You don't expect it. So when I met the orthopedic, getting the first news that he's going through my hip and my back injury, and he starts talking about metastasis and things like that, I just kind of blanked out. And I kind of came home stunned to Kathy, and we were just kind of confused and upset. It was a shock. And then he set me up with the oncologist that I'm currently with through his connections, and they confirmed everything through not only more scans, but again, they did do a biopsy on my hip to confirm that in the metastasis in my hip was renal cell carcinoma. So that definitely was a shock because I had no symptoms. There was no blood in urine. There was nothing, no pain, no anything. I was and we'll get into it later, I'm a very active person. So it was definitely a shock. So coming home to Kathy, it was a shock to both of us, and it was upsetting. And I'll admit, we shed a lot of tears those first couple of days, and trying to get our head around it. Let's say, maybe a couple of cocktails a couple of nights, to kind of soothe the nerves a little. But what we did was, once we knew what we were facing, we finally said, okay, tears are over. This is over. We're taking it on. And I came up with a mantra of win today. Don't worry about tomorrow's battles until tomorrow. Focus on today and win today. And I figured if I can win each day and I win more days, then eventually I'm going to win. And Kathy was all on board with that, and she has supported that since day one. Like I say, she's and because, when you talk about caregivers and all, I'm not in a situation where I require, fortunately, care. I'm working every day. I'm exercising every day. She's my chief support officer. She's the one that when I start kind of drifting, I had bad days just like everyone else, and you kind of get preoccupied with some negative ideas in your head maybe, or you start thinking, or maybe it's sometimes hard to think long term, make plans for a few months. When you start kind of getting down, she's the one that snaps me out of it. She's the one who's like, okay, you were down today, you can't be down tomorrow. You need to snap back and get yourself together. And she calls me out on it and keeps me honest. And the other thing she does is we've made some lifestyle changes, and she, as she said, is an avid runner. She definitely was much healthier than I was, even though I'm active. And she was all on board on getting our diet changed and sticking to it and getting us into new routines and keeping me honest about it. Without her, I wouldn't be in the healthy state that I'm in right now, all things considered. She keeps me driving my focus forward, and she keeps me wanting to do better, but then she's also the one who is keeping me honest about my feelings and my own actions and how I'm handling things on a daily basis. So She's been just a huge asset. I mean, I've got great friends and my family's supportive, but without her, I don't think I could have pushed myself to the point where I am right now, and really had, I think, so far a very successful treatment over the last 18 months.
No, that's great, Brian. Thank you. And I think you make a very important point, and that is that everyone should have a chief support officer. You know, whether it's their spouse, whether it's a sibling or a friend, but somebody who can really take the lead of helping you with navigating. So, Kathy, you want to share a little bit about the diet changes that Brian mentioned and things that adjustments that you've made as part of that?
Sure.
And I know, Kathy, do we have you yet on photo? We may not have a Kathy on video at this point. So let's circle back with the camera to Brian. Go ahead, Kathy.
Okay, sure. So as Brian mentioned, you know, I've tried to live a healthy lifestyle just with running and diet and exercise. So for me, moving to a plant-based diet, which is what we eventually went to, was not a stretch. I think for Brian, it might have been a little bit more difficult because his diet consisted, at least on Fridays, you know, making sure he had his bacon cheeseburger and fries and his, you know, his beer to kind of unwind for the week, and it was kind of like a celebration. So he had that kind of routine going for a while. So getting rid of his beloved steaks and burgers was a little bit hard going into the plant-based diet. But before the diagnosis, we had tried to eat clean. We had meatless Mondays. You know, we would try different vegetarian dishes. We know people that follow a vegetarian or a vegan lifestyle. So, you know, it wasn't a stretch for us, but, you know, we're creatures of habit and we like what we like. But with the diagnosis, we went full force into the plant-based diet. We talked to some of his doctors about, you know, cookbooks to use, recipes to follow. And initially we were given the cookbook Oh She Glows as a recommendation. So we got that. We tried a couple recipes, really liked it. And the more we looked into plant-based diets and the food that you could eat, it really wasn't a stretch from what we were eating before. We were just eliminating the meat, if you will. So we like Italian, so we make spaghetti with mushrooms rather than meat sauce. We like Mexican food, so, you know, rather than having ground beef or pork, we, you know, have more black beans in the process. So making the switch took time. It wasn't something that you just flip a switch and do it. It's a gradual process, but I think right now I would say we are probably 98% plant-based. We do cheat every once in a while. Sometimes we still want, you know, chicken or turkey with Thanksgiving coming up. You know, definitely indulge a little bit in the turkey. But for the most part, we stick to that diet. We don't eat a whole lot of dairy, and even eggs. We eat those in moderation, but not at the frequency that we did. So everybody's different. I think that if you look at the foods you like, I think that's one of my recommendations is look at the foods that you like and think about how you might be able to, you know, make those same foods with eliminating the meat that's part of that recipe.
No, that's great. Thank you. I've got a question from the audience for John, as far as participating in clinical trials. So the question is about participating in clinical trials. And then another question is getting drugs FDA approved, and have any of the clinical trials led to drug approvals?
Yeah, so, you know, I made it a decision, we made a decision, meaning my wife and I, my chief support officer, that if there was a clinical trial that was available and it could help me and help others and not hurt me, that we would try that. So I have yet to try any, standard of care treatments that have been FDA approved. The clinical trials that I have been in, I've been in really 3 of them. The first was a vaccine trial that was supposed to prevent reoccurrence or reduce the chances of reoccurrence. And that one ended up not getting funded. It had some positive outcomes, but it ended up losing funding. The company went under, so that did not get FDA approved. The clinical trial that I was in for 2 years, from 2017 to 2019, is still ongoing. They are looking at this trial for melanoma, kidney cancer, bladder cancer, triple negative breast cancer, and a few other types of cancers. It's a combination trial, so half of the drug is nivolumab, which is FDA approved. Opdivo is the street name. And then Nectar-214 and KTR-214. Bempeg is the trial drug, and that's still ongoing. So it's results have been positive. It's been going on for several years now. I was patient number 10 in the trial, and they are recruiting for more people. The thing about the trials is they do take a long time to go through the process and recruit patients and get the data back to move it through the different phases. So the trials that I have been through have not been FDA approved yet. The third trial was just a study studying SBRT, which is a radiation therapy for the nodule, the last nodule that I had in my lung, which was successful, but it's really studying the effects of how it interacted with my immunotherapy that I did previously, because the immunotherapy, once it was in my system, hasn't gone away. So they were looking to see why it didn't take care of the new nodule that popped up. So, a lot of questions around clinical trials, and it's really just trying to figure out which one is the best for you and which one you're eligible for, and what the commitment is. It is a big commitment, or could be, and depending on your location and where you are, if there's a center that's doing one close to you or not, are you able to travel to it and get the support that you need to be able to follow through with it. So.
And where did you find the most helpful information, John, on considering participating in clinical trials? Was it from your physician, from a family member?
It was really a combination. So after I was initially diagnosed, I really started digging deep into, my disease and treatment options, and joining forums and, KCA and some of the online, forums that are available, Smart Patients and so forth, and really just trying to understand what those options were in case it did come back. And following the clinical trial paths for renal cell or clear cell renal cell carcinoma specifically, there was, kind of the time when I was diagnosed to now, the whole shift into immunotherapy was happening. And so I started following that pretty closely. So when it came time to make a decision, when my cancer came back, my oncologist at MD Anderson, luckily I'm here in Texas and close to, I'm in Austin, close to Houston. My oncologist did inform me about a trial that I would be a good candidate for. But even then, I went and got a second opinion on some other trials that were going on up at UT Southwestern in Dallas. Went up there and met with an oncologist up there, and really made the best decision for me. And that the one in Dallas turned out I wasn't going to qualify for, just because some of the parameters around biopsy collection and so forth, and the main lesion in my pancreas, we didn't want to really touch it too much. So settled on the one in Houston, and ended up, like I said, being in that one for 2 years, which was successful. So continuing to watch that one, hopefully it continues to have success and eventually get FDA approved.
Wonderful. Thank you, John. And I would encourage individuals also to think about the panel discussion that's going on this afternoon at 2:45 p.m. that is talking about shared decision making. And if you have other questions on how to navigate the system with a clinical trial, that would be an excellent session to ask those questions of as well. So keep that in mind for the other sessions for the day. Michelle, as far as treatments, were you ever recommended to think about a clinical trial?
There, at this time, we don't have one that he thinks would work for me. We've looked at a couple of things, but at this time, we have not. I'm not opposed to the idea. At the time, you know, it was surprising to me and kind of thrilling to me that my grandfather, when he had cancer, he did use clinical trials, and he went through MD Anderson and through programs there until at some point he chose quality over quantity of life. But the thought that some of the research that my grandfather did by participating in these trials could eventually help me is just a huge thing for me. And that's part of the reason why I, you know, have participated in, you know, different forums and different things that are showing, you know, for what the next steps could be. You know, I mean, we're all looking for, not just for ourselves, I'm sure, we're looking for the future of, you know, the next generation that is hopefully not going to have to fight this disease like we are. But as far as a clinical trial, I've not, at this time, they said there may be one coming up that would be best for, you know, each patient's different and each set of circumstances are different. So at this time, we've not done any type of clinical trial.
Great. Thank you very, very much. So I've got another question from the audience. And Kathy, I'm going to direct this to you. Is there any evidence that dietary changes such as plant-based diets can improve or affect kidney cancer outcomes? So has there been any clinical trial or any published literature that helps support changes in plant-based diet, or is that something that just is an important aspect of your and Brian's management?
So I would say it's definitely an important part of Brian and our management of his kidney cancer. There is research ongoing, but I don't know that there's something definitive out there. You know, a lot of different studies have been done that kind of point to plant-based diets helping because of, you know, immunity and things like that. But I wouldn't say that I know of a study that's definitely pointed to it as being, you know, something that people should do. Brian, I don't know if you want to speak more on that. I know you've been researching a lot of this, and early on you found a book that kind of took us on a journey about why we would want to go down a plant-based diet.
Yeah, there's I haven't seen anything definitive on kidney cancer, but just cancers in general and the ramifications of eating red meat and basically animal proteins versus plant-based proteins. And so there's a lot of studies there in cancer in general that we've read about. Again, there's the Ocean Glow books is written by a doctor that Kathy looked at, and then some of the other books. Then I've read a book from Dr. Walter Longo. He's actually an aging specialist, and he has a diet called the longevity diet. And he talks a lot about cancer and fighting cancer and trying to prevent cancer through diet, as well as even chemotherapy side effects and dealing with it because you're on a plant-based diet. He also gets into the intermittent fasting. I did not do that. My oncologist was like, no, we are not going to venture down that path because he's in the process now of doing clinical studies in Italy of his intermittent diet and how it works with immunotherapies. He's done a lot of work with chemotherapies. But the theory behind his diet and meat in less meat and animal proteins and moving more towards a plant-based diet has been consistent through several other books we've read about, anti-inflammatory diets and things like that. That's really the fight with cancer, right, is the inflammation in your body. So we kind of looked at anti-inflammatory diets and different things and just kind of landed on plant-based as the one that we felt was best for us.
Super, thank you. And I think that along with that goes a referral to a dietitian or nutritionist, or if the center by you has a functional medicine program. So there are probably some good resources that would be available. And you can always send questions like this to the Kidney Cancer Association, and they can help you navigate that process. And Courtney can talk a little bit later about Rosemary's role as a patient navigator and a liaison. So there are a lot of resources that we as clinicians don't always have the best handle on, but as a team with the Kidney Cancer Association can help gain that information and share that information with you. So that's one of the great resources in reaching out to the Kidney Cancer Association, to gain knowledge and new information. So thank you very, very much. I'm going to open it actually to the panel. Is there anyone on the group that looked at diet changes or had guidance with a dietitian? Anybody else want to jump in?
I did.
Okay.
I did. When you're recovering from nephrectomy, you have a few weeks to do some research, and I got in contact with a doctor named Dr. William Lee. He wrote the book, Eat to Beat Disease. And we talked for a long time. We met. I sent him my scans. I sent him by the way, I have a unusual subset of kidney cancer. I have chromophobe. And we discussed things to help the immune system, some NIH studies. He told me that there was a lot of information on how the microbiome affects our immunity, what we eat, the prebiotics, the probiotics, like Brian is saying, exactly right. A lot of raw vegetables, a lot of vegetables themselves flash cooked, helps grow that immune response, helps bring prebiotics to the gut, probiotics to the gut. Absolutely, plant-based is a way to go, but also not white bread. There's a lot of studies on white bread and its cancer causing and sugar uploads, and how to make more whole grain decisions, how to make more lentils, things like this, things of that nature to help grow the microbiome in the gut. So I completely changed my diet as well as Brian with the help of Dr. William Lee. And I'm still currently doing it today. So I'm attributing that to part of hopefully the continued success I will have, and the fact that I've been in remission now for 2.5 years. So it definitely made a change in my life, changing my diet, bringing in some exercise in the diet as well. So 5 days a week, and not too heavy, because you can also cause inflammation if you're lifting 100 pounds and going too hardcore. So walking, swimming, doing what you can, a little bit of light yoga, helping detoxing, moving the blood. And seeing first, of course, and foremost, checking with your doctor, making sure that that's an okay thing for you to do in the stage of healing that you are in. But I attributed both exercise and a diet change as well.
Wonderful. Anyone else wish to share? Okay. So, John, you're in a unique situation. When we talk about coping and managing, you've got, a young son. How did you help your son understand the fact that you were going to need treatment, that you were going to be dealing with this diagnosis?
Yeah, so thanks for bringing that up. My wife is also a cancer survivor. She was diagnosed with stage 3 breast cancer in between the time that I was in remission. So in 2013 to 2014, 2015, and with all the things that go along with treatments for breast cancer and chemo and radiation and mastectomies and reconstruction, it was a long process. So our son was, God, how old was he? 5 years old when I was first diagnosed. So that, he didn't really understand, when I had my surgery. But when it came back in 2017, and really he first saw it with my wife. So that was really a challenge, because with breast cancer, it's very physical, and with the chemo and radiation and losing your hair, it affected him more with my wife's diagnosis than I think it did with me. And he learned a lot more from her going through treatments and what she went through. So when she was done through all that, and then when mine came back in 2017, we at first tried to, I wouldn't say hide it from him, but just kind of dismiss the fact that mine came back and, hey, daddy's got to go, to Houston for some treatments, and, he's got to, and we're still talking to him really like he was a young kid. And by this time he was 12 years old. And it was at a pediatrician appointment where they were going through patient history and family history and so forth. And my wife had said, yeah, my husband, currently has cancer and he's going through treatments. And my son kind of stopped in his tracks. He's like, wait a minute. You didn't tell me that daddy had cancer. So he goes, he kind of gave us a lecture. He sat us down. He's like, that's something I need to know. So, kids are a lot smarter than you think. So we kind of involved him with it. We tried to keep things as normal as possible for him. I spent a lot of time in Houston. I had to go there every week, and I actually had to live there for the first 30 days of my trial. So we leaned a lot, of course, on our support system. We, at that time, that's when we really needed the help of friends and family to kind of try to keep things as normal as possible for him. And since then, we've gotten him involved with, we started a foundation to raise money for kidney cancer research, and we've gotten him involved with that. He's now going to be raising money for the Leukemia and Lymphoma Society as part of an initiative that they have where they nominate students. He's a freshman now in high school to go out and raise money for them. So we're starting to get him involved on the philanthropy side and trying to turn it into a positive for him and for all of us to try to give back and make a positive change in the world. So.
Anyone else want to add to that?
I think that so far, most of us have mentioned the support of our family and friends. I think that that's a huge part of keeping you going, like Brian had mentioned, you have one bad day, but then Kathy was there to say, your bad day was yesterday. Let's keep going today. Initially, from the start, we started, my sister and I started a private Facebook group that we call Knocking Out Kidney Cancer. And we're able to give updates on there about things that are going on. This coming week, I have an MRI and an appointment with the oncologist on next Wednesday. But I can easily share information with our family and friends in that private closed group that I wouldn't have to make phone calls to, 20 people when I'm tired, or, maybe it's not a result that we want, and you don't have to explain that to everyone. So for us, that really worked to have that support. On the days of my surgery, my sister arranged through that group for everybody to wear orange. And so people posted throughout the day while I was away in surgery, pictures of themselves wearing orange and after surgery. And even since then, I've gone back to that page and seen my support system wearing orange in support of me, which was a huge thing. The support of family and friends, my sister also arranged, there are apparently, I didn't know, but websites where you can arrange for your friends to sign up. We talked earlier, my surgeries were 6 weeks apart. Those are two major surgeries within 6 weeks. And arrange for family and friends to drop off dinners, and they would sign up for a certain day, and there are just websites out there that will help you manage those kinds of things. But without the support of my family and my friends, I would not have made it through those times as easily as we did. And you're talking about also involving your family. My children are now 17 and 19, and it's had a huge effect on them. They also had lost their father previously, but so I was their rock. I was what they had. And, finding out that news was devastating because, when you're young, you think of cancer as, possibly, terminal or, things like that. And so, it was scary for them, even though they were teenagers. And it's changed their outlook on things. It's changed, well, let's do this. Why not just try it instead of saying, oh, we'll wait to do that. Also, one of my daughters, she's always been on an engineering path her whole life. I'm going to do this, I'm going to do engineering. Well, after spending time in the hospital with me, seeing me intubated, she's now applying. She starts college next year, and she is already planning, I'm going into nursing because that's what I want to do. You know, and so it does have an effect, and you think it doesn't affect, you know, that, but that's, you know, your family and your friends and your support group, really. I mean, I think all of us have attributed a lot of our success to our family and friends.
Yeah, definitely. Definitely. Thank you. So, Brian, talk a minute about side effects with immunotherapy. How did you navigate those? How did you incorporate and or manage your exercise program?
Okay, so with my initial treatment, I had radiation and immunotherapy. I was started on a Yervoy Opdivo. And the initial side effects I had there were through the radiation because they were hitting areas in my spine, which would go into my, affected my stomach and my appetite. So foods that I actually loved, I hated now. You just had bad taste in your mouth. And so going through that radiation cycle, which was only a 10-day cycle, but I started losing weight, things like that. So what we said was forget the plant-based diet for a little bit. Eat what you want to eat, just as long as you're eating. And so to deal with those side effects, I binged on KFC, mashed potatoes, and macaroni and cheese. I hate Chick-fil-A, and I craved Chick-fil-A. So we ate Chick-fil-A for dinner. And so for a couple of weeks to get through that, so to keep my strength up and to keep my energy and my weight up, it was important just to really just get food in me versus really worry about eating plant-based or not. And then as those side effects from the radiation started to subside, I could have started to transition back to my diet. But one of the things I wanted to do is become active again, because from hurting my back being the original thing through diagnosis and starting treatment, it had been almost a year since I really worked out. And I'm a lifelong soccer player. I've played or coached soccer for over 30 years. I surf, I paddleboard, I do all that, race paddleboards, I do all that. So I'm very active. And so having a year of no activity was kind of unnerving to me, and it was very stressful, actually, because that's kind of how I find my release, especially surfing and things. So I started to say, all right, I got to start exercising. It was just ironic that, or coincidental, that just before I was diagnosed, Kathy, the runner, purchased a Peloton treadmill. So I think I used it twice before I was diagnosed. So I was like, we have this treadmill. It's in the house. I need to start using it. I got to start exercising now that I'm through my radiation. The Opdivo itself really didn't cause too many side effects except for the hypothyroidism. And I'm on medication for that. But again, trying to keep my energy levels up. I know from being in sports my entire life, you want to keep your energy up, you need to keep doing things. You can't just sit around. So I started on the treadmill, and I started off walking. And then I started off running, and then I started off on power walks, and then I would increase. And so each month I would kind of increase it through the end of the summer and into the fall to the point where I was running. And so, and I was running, I probably run 10 to 15 miles a week at that point. So I got to the point where December came, and a race that we had run previously here a few years ago was having their race in April, which would be about the year anniversary of my diagnosis. And I said, you know what? I'm going to prove that I can fight this again, win today. And so I decided that I was going to run a half marathon. And so we started training for the half marathon through the winter just after Christmas on treadmill, 4 or 5 days a week on that treadmill, running. And so COVID hit, and they decided to make the run virtual. And so Kathy, who is, the diehard runner, is like, I'm not running a virtual race. She dropped out. she's like, I don't want to run a virtual race, but she said, you can do it. So I ran the half marathon virtually on the treadmill, but that's sitting behind me in one morning. And Kathy would come down and check on me and root me on, and while she was keeping the dogs away. But keeping that activity was important. So that was a major goal for me to be able to run around the 1-year anniversary of my diagnosis, was to run that half marathon. Because I'm not the runner, I'm the soccer player. I'm a bacon double cheeseburger guy, 2 IPAs on Friday. Well, not anymore with the Devo. So that was a significant accomplishment for me. And then since then, I've been able to, I don't run that anymore, but I still run about 4 times a week. But I've now then progressed into getting back into the paddle boarding. We have paddle boards at the beach, and we paddle distance and things like that, and out on the ocean. And then I've started, I haven't been cleared necessarily, but I've started to get back into the surfing, because that connection with the ocean to me is just my zen. That's where I can just, Kathy knows when I start stressing out, she's like, you need to go and be in the ocean. And everything just kind of calms, and it just has that kind of effect on me. So I've started to get kind of back into the surfing and being in the ocean again and those activities. So I've just slowly started progressing and adding it back in since then. And I find that you need that outlet, whether it's healthy, obviously, to be active, whether you're walking or running or what have it. But you need to find those activities not to only keep your body healthy, but it's your mind too. A lot of it's mental. It's really finding that place where you can kind of focus on something else besides having cancer. I can tell you that the first time this summer that I was back on my board and in the ocean, I mean, it was knee-high waves. I was just out there on a paddleboard, just practicing turning, just trying to get balance again. And for an hour, probably the first hour in over a year, I didn't think about cancer once. And that was just a revelation to me after I went home and kind of thought about it. Like, you didn't think about what's affecting you at all that entire time you were out there. And it was just a change that came over me at that point, and it kind of helped me to refocus on keeping that positive attitude and focusing on things that are really important, and not just being sidetracked and pulled down by that nagging back of your head. This is what we have. We're dealing with it every day. So for me, being active is both physically and mentally rewarding. Some of the other things we do is I do yoga, we do meditation, all those things just to kind of help focus you and keep you centered and clear your head, I think are just really important. And I think it's important for people just to find that outlet that's best for them.
Great. Thanks, Brian. I've got a question here. Salima, I'm going to direct this to you then. What do you find to be most helpful in dealing with feelings of anxiety, fatigue, getting up, doing what you can? Do you want to talk about that a little bit?
Yeah. Every single every single cancer patient, I think, deals with this. It's extremely daunting getting a diagnosis. Honestly, there's 2 things. I think that first and foremost, accepting that you're going to feel these waves of anxiety, of depression, of loss of hope a little bit. These are thoughts. These aren't yourself. And we don't have to necessarily ride that wave. We can stay centered. And the second thing with this is try to, and it's difficult, but it's doable, to stay in the now. And what I mean by that is when you notice that for me, what works when I notice that my brain is, just so busy with these thoughts of anxiety or busy with these thoughts of sadness, that you realize they're there, but you don't have to entertain them. You can go ahead and continue doing what you're doing and have a good time and go garden and go hang out with your family and not give them that power and just kind of let them float by. They do like waves in the ocean. They'll come and they'll go, and they'll come and they'll go, and not necessarily just ride that emotional wave. And secondly, to practice mindfulness, to be in the now and to say, right now, I'm spending time with my family and I'm enjoying this time, and this is what I'm doing. And I notice that when scans come up, when we're looking in the future, the unknown, that's when the anxiety creeps in the most. So if we can try to say, hey, guess what? Cancer can't take away this moment right now. I have this awesome moment, and I'm going to do the best I can with this moment in time now. And I've noticed for me, that's been the best way for me to deal with it and cope with it.
Super. Thank you very much. John, I'd like to have you kind of follow up on that. including the discussion on side effects. And we're on a different type of therapy. What did you find helped you get through managing those side effects and maintaining focus?
Sure. Yeah. So first, just to touch on what Salima was saying, I kind of live my life kind of every 3 months at a time, because that's when my scans are. So we try to, go on our vacations and just live in the moment and just have as much fun as possible, and be the best that we can be. And like she said, every 3 months, or when scans come up, you get that anxiety, you go through it, you deal with the results, whatever they may be, and then you move forward. So, in terms of side effects, my immunotherapy, I kind of went through a different side effects as the trial went on. Everybody was different, with meeting the other the other patients that were in the trial and talking to them about some of the experiences that they had. I found that everybody was different, and some people had to leave the trial because side effects were too bad. I felt I was lucky in that mine were manageable. Things like, when I first started the trial, I would itch and get rashes and so forth. And talking to fellow patients as well as my medical team, trying different types of lotions, for example, to help mitigate that and make the symptoms more manageable, things like that. I had, low-grade fever initially, that eventually went away. My symptoms kind of moved more towards arthritic pain and gastrointestinal issues. So, I found that having a ginger ale after treatment would help my gastro issues. Taking things NSAIDs, since I have one kidney, doing certain things to help with arthritis. As I went through the trial, my symptoms, I knew what to expect, so they became more predictable. So I knew that, on day 2 after my immunotherapy infusion, that my arthritis would start to set in. So I kind of knew to move around, and in the morning I would be a little bit stiff, and as the day went by, I'd be fine. But with immunotherapy, and specifically for me, after day 4 or day 5 after my infusion, things would kind of subside, and I'd kind of start feeling normal again, and the fatigue would go away, and things would start to get back to normal. So I was on a 3-week cycle. So every 3 weeks I was getting infusions. So I knew what to expect leading up to that. I knew to kind of clear my calendar, because, after my infusion, I was going to be tired, and, I needed to rest a little bit during the day. So we scheduled our trips and our vacations and our activities kind of around my treatment schedule and around those side effects that I would have. So, if anything I could say is everybody's side effects are different. I talk to other patients to get tips on how to deal with those side effects, and I learned to live with it and kind of schedule my life around the side effects.
Great. Thank you very much. We've got a question from the audience that I want to pose to the panel and see if there's anyone in particular that would like to respond to this. And this is about financial concerns and investments and managing finances. Is there anything that any of you have found to be helpful in regards to financial management?
Hey, this is John. Just to touch on that, we have been fortunate to have insurance and jobs. With that, I don't think any insurance plan covers 100% of any procedures that you're going to have. So there certainly is a financial impact, and with deductibles and copays, and once you get to a certain point in your insurance, you pay a portion, they pay a portion, and that adds up with all the doctor's appointments and standard of care treatments. Although I was in a trial and the trial drugs were paid for and some of my expenses were paid for, and that does vary by clinical trial, there still is a significant financial impact. And fortunately, the MD Anderson, where I went to go, they have payment plans, are able to, put any remaining balances into a payment plan, non-interest bearing payment plan. So it's really talking to your hospital and institution and trying to work out something with them. And for us, it was, I was going through treatment, and then my wife's situation came up, so we were kind of double impacted there. But we were both able to work out financial agreements with those institutions, and continue to do so today. So that's my 2 cents on that.
Super. Anybody else want to comment on that? Yeah, I think otherwise it's important to have a financial manager and someone that can help you with an unbiased view make recommendations on how to manage financial decisions, because that is a big important thing. No, that's excellent. Thank you. So Salima, tell us a little bit about the Kidney Cancer Association has a new Patient and Caregiver Advisory Council. Can you share a little bit about how you got involved and what that council is about?
Yes. So how I got involved is I actually contacted the Kidney Cancer Association and wanted to let them know my story, what I've been through. I wanted to share with others that we can get through this all together. It takes a village, right? So we can all share our stories, not feel alone, especially for those who don't have family, don't have that chief support officer. Some of us don't. My family's overseas. We don't have any family here in the United States. So it can be tough. And the advisory council advises, it's exactly what I'm talking about. It shares patient stories, things they've gone through, trials like John has, and it helps form a opinion and judgment on for all the survivors, so that they can see what everyone's gone through. It's a wonderful support system. It's a wonderful council. I'm very, very thankful to be a part of it.
Great. And so others can reach out and find other opportunities then to share their stories with the Kidney Cancer Association. And there are ways that you can then help others who are beginning the journey and learning, trying to navigate it as you have done previously. Kathy, I've got a question for you. What is the most important thing that you and Brian have done, or more importantly, you've done to try to help navigate all of the medical visits and things like that, and treatments and information?
Yeah, so when Brian was first diagnosed, I think that the thing that we wanted to do was make sure that, any questions that we had, because this was all new to us. We didn't know what to expect. I think based on our history, we've had family members that have been diagnosed with, cancer, whether it's breast cancer or colon cancer. So we knew what happened with those individuals as far as treatments and things like that. But this was something different. And we almost jumped to conclusions without having that knowledge, thinking this is the path that Brian's going to go down. And, that built anxiety for us. So we started immediately questions that we were going to have at that initial visit. And we got a binder together where we would write down all the questions that we wanted to ask. And then when we went to that first appointment, I was the note taker. So I would write down if I didn't understand something. It was my responsibility to ask a question, a follow-up question. If I couldn't spell something right, ask the doctor, how do you spell that? What are you saying? Repeat back what the doctor said. So I made sure my notes were accurate. So when we did come home and we discussed what we heard, every once in a while, Brian heard something different than what I heard. And, he talked to his parents about his, doctor visit. And I say, no, that's not right. That's not. And then we'd have to go back to the book. So we have relied heavily on making sure all of the doctor visits have been documented, making sure that you have a note taker in those appointments if you can, just to make sure that everybody's hearing the same thing, or you can go back to what was said. And if there's still confusion, put that question on the follow-up list so that when you do go back to the doctor's visit, you can ask again, or you can reach out to the doctor and say, hey, we need some clarification because I'm not sure we understood, what was being told. I think it helps make your decisions a little bit easier when you can go back and refer to those notes and keep track of all of that in one place. So that's been very helpful for us. With COVID, unfortunately, I have not been able to go to the doctor visits with Brian, but we still, are there any questions that we want to ask, and make sure that those get written down in the notebook, and Brian does take that with him so that he can have those follow-up conversations.
Wonderful. Thank you. And Michelle, I know you have something similar. You want to share how you've used some resources to help you through your diagnosis and ongoing follow-up.
Right. I also do have a binder, and it's kind of funny because when we first started this journey, the family was involved. My oncologist kind of laughed when we showed up for these first appointments, and they were like, you brought a team with you. Yes, I did. I brought numerous family members who all came in. They were bringing chairs in from everywhere in the office so we could all be a part of it. My sister, actually, she had come in from Dallas at that point, but for appointments that she cannot come in for, or if Kathy said with COVID, my husband would come to appointments, but he'd have to sit in the waiting room. My sister will be on the phone and she's taking notes the whole time. She will ask questions. My doctor, I know that some doctors will or won't allow it, but my doctor does allow someone to be there that way, because when you're getting a lot of information, all of it is not sinking in. Like Kathy said, Brian would hear some things, she would hear some things. So I have a binder, I actually have it here. I bring it with me to all my appointments. It's got tabs in it because sometimes some of my appointments are at different facilities, and so the materials might not be shared. So it's got results from blood work, it's got pathology, it's got lab reports. I even keep my insurance stuff in here, my bills from the hospital. Then there's a tab here with medicines, if any prescriptions, I keep the handouts from those. And there's one with notes in it that are just notes that, are typed up from different appointments and stuff like that. So I feel like it's really easy to go back and find out, well, when was that? And it helps with keeping things on track. And like I said, if you go to a different facility, you've got all of this there in case, sometimes it takes a little while for one doctor to send another doctor information. We also, I know we talked about the genetic testing. We made a little chart in here with it's all color coded with who's been tested, who's positive, who's not. It's just easier for us to keep track of. And when doctors are sending information out to you, sometimes it's fast. Sometimes, again, words you might not know or understand. My big thing, I always ask questions, but to have someone else there, because if you get information from a doctor and you're thinking about that one point, and you're because that kind of hits you hard, you have someone else, even if it's someone on the phone, to take notes and to make sure. But and so if we have to go back and question, we always look in the binder and see. But it's getting kind of big now, but we made it to a year, so we may need to do a year 2 binder, or we may need to adjust. But that's a big thing. My biggest thing is we can't control the cancer, but we can control how we react to it, and we can control our actions and how we proceed forward. It's not the cancer that we're trying to control. We just can control the reactions and, how we deal with it.
No, that's great, Michelle. Thank you. And from a clinical perspective, it is extremely helpful to the oncology team to bring some of that information in, particularly if you have had treatment, whether it's surgery, radiation, or drug treatment at different institutions. In spite of the electronic medical record being connected, you can't always, it's not always user friendly. Knowing when you started, when you stopped the therapy, what therapy you had is critical as we have continuation of care and other treatments available. There are videos, and I would highly recommend that you see some of the pre-recorded videos that were done, particularly one done by Patty Fisher on clinical trials, to understand the different phases that drugs go through prior to FDA approval. And as John alluded to, there are certain criteria that you need to meet that will either qualify you or disqualify you from being eligible to participate in a clinical trial. And the level of detail that we need really is helpful to have that information in a binder, or at least have it written down. If somebody comes in and they've got a 5-page document that says, here's when I was diagnosed, here's what I was treated with, that is phenomenal. It saves me an immense amount of work, and it saves the oncologist from recommending treatments that you're not going to be appropriate or eligible for. So strongly encourage that you and or a caregiver do that. I think that leads into another question that I would like to circle back to. I know with Brian, and I think probably also John, second opinion. What would you, and Kathy also, what would you recommend that people think about, or when to think about the need for a second opinion? So Brian, I'll start that one with you.
Okay, yeah, and I think I might have lost video that on me. I see the warning come up
okay.
With other panels. But for me, I'm a big believer in second opinions in general. Again, doctors are great, they're professionals in what they do, but again, they're human, and they only have so much experience and knowledge, just like all of us in our professions. So I am a big believer in getting a second opinion. So with me, when I first got my diagnosis, it wasn't even something that I considered, do I want to do this or not? Even my doctor, just as I was asking him about second opinions, he was recommending to go get a second opinion. And he even gave me names to look into at UPenn, and that's who he recommended. But I went home and I did some research, again, trying to stay off the internet at that time, but doing the proper research. I went to the American Cancer Society. I went to some of this organization, KCA, and some other kidney cancer organizations to do some research, and did some research on what's close to me, what's reasonable. And I found, that some of the top cancer centers on the East Coast are in Philadelphia. You have Jefferson, Fox Chase, UPenn, and then there's MD Anderson, even over in New Jersey. And for me, Johns Hopkins is even only, a little over an hour away. So I had a lot of options. So it was very important that I kind of researched them and researched what their philosophies were in doing treatment before I actually selected definitely to go to UPenn at that point, because their philosophy and how they treated the cancers kind of aligned with kind of what I felt comfortable with compared to some of the others. And that's kind of where I went. But I highly suggest if this is your life, and just taking one person's opinion to me is kind of short-sighted. I think you really should get second opinions whenever they're talking about changing your course of treatment, initial courses of treatment. Any of those decisions, I really suggest second opinions.
Yes, and the kidney cancer is working to improve the option and the ability to help match with patients in clinical trials. So stay tuned. That's going to become a goal for the coming years to improve that resource. So John, what would you like to add to that about second opinions?
Yeah, I'm with Brian. So, I think he alluded to it earlier. He talked about it earlier, whether to get a nephrectomy, not to get a nephrectomy. So when I was initially diagnosed, my doctor here in Austin said, yes, definitely looks like kidney cancer. We got to take your kidney out. I was like, okay, well, great. Let me see, what somebody else says. So I did get a second opinion at a doctor in San Antonio. He's like, yep, definitely looks like kidney cancer, but we can do a partial. I can save your part of your kidney. And I was like, okay, so that's some conflicting information. Let me go get a third opinion. So I went to MD Anderson. Met with my surgeon there, and he said, yes, definitely looks like kidney cancer, and we definitely need to take your kidney out. So, with that information, obviously, 2 against 1, conflicting data, went back to my doctor in Austin, said, here's what everybody's saying. And it was funny that both the Houston doctor and the Austin doctor said, the one in San Antonio, he's young, isn't he? And I was like, yeah, he's a younger doctor, a little bit, more aggressive and confident of what he can do. But, with that said, it's important to get those varying opinions and really, you are your own decider in what happens to your body. So, the best you can do is get as much information as possible, and make those decisions and what's best for you. So those second and third opinions are very important, and not only to get their information, but it's also an education period for you to really gather as much information as possible and make those best decisions that are going to move you forward. And when it came to time for the clinical trial, it was more of the same thing. Was is this trial the best for me? What's your opinion on this trial that this other institution has? Mm-hmm. And at the same time, what trials do you have to offer? Do you think that's a better a fit for me? So, you'll find that with these, if you are seeing a kidney cancer specialist or oncologist, that they all know each other, and they all, say, oh yeah, I know your doctor over there, and he's making a good decision, and I think that his recommendation for this trial is good. It's not a competition of, at least what I found, and not a competition of, hey, we want you as a patient, we want you in here. It's all the doctors that I have talked to that have been specialists, like I said, knew each other, and they all agreed with each other on what the best course of action was for me. So that's been my experience.
Yes, and I think that's one of the most important things, as you alluded to, is making sure that everyone on your team is on the same plan and supporting you through that. And right. So that's a key thing. This is something else where Rosemary is part of the Kidney Cancer Association, and her role as navigator can help you reach out to other facilities, help you identify someone who would be an appropriate second opinion. I know there was an individual who commented in the chat box about transition. Their current oncologist is requiring, and they don't live as close to the new oncologist, and just how to establish trust to make sure that that's the right person. So not living close to your oncologist and the cancer treatment center is a big challenge for sure. We've got about 2 minutes left. I'd like to offer it back to the panel if there's anything. Selena, anything that you want to add at the very end here that we missed earlier?
I would think that emotionally, it is a very difficult time when you're first initially diagnosed, and the whirlwind of thoughts, of feelings, of whatnot, and take it like Michelle, get a binder, take it one step at a time, take it one thought at a time, segregate those thoughts and separate those thoughts and go and hit them one by one. Get doctors' opinions, like John was saying, get multiple doctors' opinions, and Brian as well. I think that's extremely important. This is your life, and to get multiple opinions is extremely important. And try to stay in the now. And do what you can in the now. That's what I add. This is a tough time, but us cancer survivors and people who are hit with cancers, we're tough, we're strong, and we hit it head on, and that's how you have to do this. You have to get that nephrectomy if you need to. You have to take the medication. You move one day at a time, and you just win, move forward, and beat this.
That's awesome, Selena. Thank you so very much, Salima. Kathy, I'm going to let you wrap it up for the day with a message to the caregivers and family members. What would you want to share?
So I would, first of all, make sure that you're taking care of yourself, because just like Brian is going through this, you go through it too. Every time Brian gets a scan, even though he's physically the one going through the steps, you know, I'm also going through the anxiety of waiting for the results. So I think it's really important that caregivers and the support team make sure that they take care of themselves, and make sure they're carving out time for themselves, whether it's to meditate or exercise or just go take a walk. I think that's really important, because I think you need to be on the top of your game in order to provide the best support for the individual going through the cancer treatment. And then I would also say that, you know, everybody on this panel is stronger than maybe you think. So as a caregiver, maybe you don't think they're going to be strong enough, but they are definitely strong enough to handle the treatments and what they're going through. So make sure, you know, you give them that support, and making sure that they know that they are strong and they can handle this. I think that's critical as well.
Wonderful. Thank you, Kathy. Thank you, everyone. Both the panelists, really appreciate your sharing your time. And we hope that for all of those that have attended this session, that you have found it beneficial. So thanks so much. And Courtney, I will hand it back to you at this point. You're on mute. Are you off? I think you're off
there
now.
We go. Oh, it was locked. It had a little lock logo on it. I was worried. Thank you guys so much. That was really wonderful. So many great learnings and tweetable moments, as Oprah would say. Fantastic job. Thank you so much. So up next, we actually have a 45-minute break. So grab some lunch or a snack, depending on where you are, and please check out the exhibit hall. And we will return at 1:45 Eastern time for the joint IKCS and virtual patient symposium session, which is discussing treating kidney cancer in a pandemic. So we'll see you back here in roughly 45 minutes. Thank you, guys.